Screening and rating scales. Screening and rating scales are the standardized tools that help us identify psychiatric disorders, assess symptoms severity, monitor treatment response, improve clinical and clinician decision making. They do not replace a comprehensive psychiatric evaluation, but they are valuable adjustments in a diagnosis and follow-up. So, by the end of this video, you will be able to distinguish screening tools from diagnosis assessment. Select appropriate scales from common psychiatric disorders. Select appropriate scales for a common psychiatric disorder. Interpret commonly used scoring systems. Monitor treatment response by using standardized instruments. Recognize the limitation of the rating scale. Why are the screening tools important? They help clinicians identify patients who need further evaluation, quantify the symptom severity, monitor progress over time, guide treatment decision making, improve communication among providers, support treatment, support measurement-based care. A positive screening test is not diagnosis. Positive results should always be followed up by comprehensive clinical assessment using the DSM-5 treatment diagnosis criteria. Screening scales. What is the difference between screening and rating scale? The screening scale detects possible illness. You are screening. You are looking for a possible illness. However, rating scale measures the severity of that illness. So screening, you are screening, you are looking for it. But rating, you already find the illness, you want to measure how severe it is. So rating, you want to rate how severe the illness is. Screening, you are looking for it. Screening used before diagnosis. Rating is used after the diagnosis and during the treatment. Screening determines the need for further evaluation. That's the screening. However, rating scales tracks the improvement and worsening of the symptoms. Screening usually is a brief. You want to screen, you want to look for it. However, the rating may be brief or comprehensive. It depends the situation. For example, depression, patient health question is PHQ-9, patient healthy questionnaire 9. The purpose is to screen for a major depression disorder. You want to measure depression severity. You want to monitor the treatment purpose. So, PHQ-9, if the score is between 0 to 4, that is a mild depression. If the score is 5 to 9, no, if the score is 0 to 4, is the minimal depression. However, if the score is 5 to 9, it's a mild depression. If the score is between 10 to 14, the depression is moderate. If the score is between 15 to 19, the depression is moderate to severe depression. If the score is between 20 to 27, the depression is very severe or severe. Question 9 assists the suicidal thoughts and requires immediate clinical follow-up if possible. The PHQ-9 is the most commonly used depression screening tool in a primary and outpatient psychiatric setting. Back depression inventory. Back depression inventory, or BDI 2, is a measurement. BDI 2 measures the depression severity, often used in a specific psychiatric setting and research. Hamilton Depression Rating Scale, or HAM-D. Hamilton Depression Rating Scale, HAM-D, clinicians administer commonly used in a clinical trial or a special psychiatric setting, or specific. Montgomery ASRS depression reading, or MADRS, is highly sensitive to changes in a depressive symptoms and often used to monitor response of an antipsychiatric treatment. For anxiety, GAD-7, Generalized Anxiety Disorder 7, is a screening for generalized anxiety disorder and measures the symptom severity. So GAD-7, if the score is between 4 to 0 to 4, like the depression one, it's minimal anxiety. If the GAD-7 is between 5 to 9, anxiety is a mild. If the GAD-7 score is 10 to 14, anxiety is moderate. If the GAD score is 15 to 21, anxiety is severe. So if the score of a 10 or higher suggests clinically significant anxiety and warrants further evaluation. Hamilton Anxiety Rating Scale, or HAM-A. Clinicians administer to evaluate psychological anxiety, physical, somatic anxiety. For bipolar disorder, mood disorder questionnaire, like the MDQ, used to screen for bipolar spectrum disorders. It used to assess the lifetime history of a panic or hypopanic symptoms, co-occurrence symptoms, functional impairment. The MDQ is a screening tool, not diagnostic test. Always confirm bipolar disorder with a comprehensive interview. For Young Manic Rating Scale, YMRS, clinicians administer to measure severity of manic symptoms and frequently used to measure treatment response in bipolar disorder. Suicidal risk. Columbia Suicidal Severity Rating Scale, or C-SSRS, is used to evaluate suicidal ideation, suicidal behavior, intense, plan, previous attempt, and it's used in the emergency department, inpatient psychiatric units, outpatient psychiatric research. The C-SSRS helps standardize suicidal risk assessment, but does not replace the clinical judgment. ADHD disorder. Adult ADHD Self-Report Scale, ASRS, screens adults for ADHD and is used to assess inattention, hyperactive, impulsiveness. Vanderbilt ADHD Diagnosis Rating Scale is used primarily in the children, complete by the parents and teachers. It is used to evaluate ADHD symptoms, academic performance, behavior functioning. SPAC autism spectrum disorder. Modified checklist for autism in a tailor refers with the follow-up M-chart F is used in a tailors to screen for autism spectrum. OCD, Yale Brown obsession compulsive scale, or YBOCS, measures the severity of obsession and severity of compulsion, and commonly used before and after treatment to monitor response. PTSD checklist for DSM-5 or BCL5 is a self-report measure and is used to assess PTSD symptoms, severity, and respond to treatment. Substance usage disorder, alcohol use disorder identification test. ADD is used to screen for ASRS, alcohol usage, harmful alcohol usage, possible alcohol dependency. Cage questionnaire. Cage questionnaire is a 4 questions and stands for cut down of alcohol, annoy when somebody tells you to cut the alcohol, feeling guilty when you drinking the alcohol, eye opening when somebody tell you that you are addicted to alcohol. Best for identifying the possible alcohol dependency rather than risky drinking, because dependency, that's what leads to the risk of drinking. For drug abuse screening test, DAST-10 is used to screen for non-alcohol substance use disorder. Dementia and cognitive disorder is used MMSE, or mini mental status examination, MMSE. It assists orientation, attention, memory, language, visual skill, commonly used to monitor cognitive decline over time. Mental Cognitive Assessment, or MOCA, is more sensitive than the MMSE for detecting a mild cognitive impairment. It's used to assess executive function, attention, language, delay recall, visual spatial ability, visual ability. The MOCA is generally performed over the MMSE when a mild cognition impairment is present. Delirium. If the patient has a delirium, you want to use the confusion assessment method or CAM to screen for delirium. You suspected it, so you want to screen. The core features include acute onset with the fluctuation course, inattention, disorganized thinking, level of consciousness. For eating disorders, SCOFF questionnaire is used. It's a 5 screening questions for eating disorder. A positive screen warrants a comprehensive eating disorder evaluation. Sleeping disorder, you want to use the Epworth sleepiness scale. Measures daytime sleep, useful in evaluation of obstructive sleep apnea, narcolepsy, and other hyperinsomnia disorder. Insomnia Severe Index, used to measure the severity of the insomnia and responded to treatment. PHQ-9 for psychiatric or psychosis. Psychosis, you want to use the positive negative syndrome scale or PHQ-9. It measures the positive symptoms, negative symptoms of psychosis, general psychopathy. Commonly is used in schizophrenia research and specific practice. For older adults, you want to use the geriatric depression scale, indicated specifically for older adults. It's available in a 30 item versions and 15 item for short form. Global functioning, you want to use the clinical global impression or CHI. There is a 3 component to the clinical global impression, and this component includes severity of the illness, improvement, efficiency index, widely used for psychiatric medication trials and routine clinical practice. Measurement-based care involves a routinely administering a validated scale at the baseline and follow-up visit to monitor the treatment effectiveness, detect symptom recurrency, support shared decision-making, improve outcomes. For limitation of the rating scale include they are adjuncts, not replacement for clinician interview. cultural factors may influence the response. Literature and language barrier can affect the accuracy. Scores should always be interpreted in the context of the patient history and mental status evaluation and functional impairment. So the disorder is depression. Peripheral tool is PHQ-9. For anxiety is the GAD-7. For bipolar is a mood disorder questionnaire or MDQ. For suicidal ideation is a Columbia Suicidal Severity Rating Scale. For ADHD is the Adult ADHD Self-Reporting Scale. For PTSD is the PTSD checklist for DSM-5. For OCD is the Yale-Brown Obsession Compulsive Scale. For alcohol usage disorder is the ADD or GAD for the depression and also ADD. Alcohol use disorder identification test or GAD, CAGE. Dementia, the drug usage is the drug usage screening test. For dementia is the Montreal Cognitive Assessment or mini mental status evaluation. Delirium, you want to use the CAM, Confusion Assessment Method. Eating disorder, you want to use the SCOFF questionnaire. Sleeping disorder, you want to use the Insomnia Severity Index or Epworth Sleepiness Scale. The use of PHQ-9 for depression screening and monitoring is always added question 9 regarding suicidal thoughts. GAD-7 is the preferred brief screening tool for general anxiety disorder in many outpatient settings. Screening for bipolar disorder with the MDQ before prescribing antidepressant medication when the bipolar disorder is suspected. Use the C-SSRS to structure a suicidal risk assessment, but always integrate the findings with your clinical judgment. The MOCA is the more sensitive than the MMSE for detecting a mild cognition impairment. Repeating the same validated scale over the time allows you to objectively measure treatment response. The follow-up question is, I have a question, and the questions are, which screening tool is the mostly used to assess a depression severity and monitor treatment response in adults? PHQ-9. A patient scores 12 or 11 on the GAD-7. How should this be interpreted? Modern anxiety. Which screening tool is preferable for identifying a possible bipolar spectrum disorder before initiating antipsychiatric medication? That is the mood disorder questionnaire. Which cognitive screening instrument is generally more sensitive than the mini mental state examination for detecting a mild cognitive impairment? That is Montreal Cognitive Assessment. I have a memory aid known the Big 8. You want to remember the Big 8 for the screening and rating scales. The Big 8 include the PHQ-9 for depression, GAD, general anxiety disorder 7, MDQ for bipolar, C-SSRS for suicidal assessment, ASRS for adult with ADHD, PCL5 for PTSD, YBOCS for obsession compulsive disorder or OCD, MOC for mild cognition impairment. Thank you for joining me today. Please prescribe and join me again. Thank you.